Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, if you've watched this show before, every week I have a different guest on the program, and we talk about different healthcare issues, services provided here at KRMC, and different things that I think are going to be of interest to you and your family. So I hope you'll stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Melanie Bradle. She is a speech-language pathologist here at KRMC. Did I get that right?
You did, Jamie.
It took me a couple of times the first time you're on my show, but now I got it.
I'm really happy that we are friends and you got that, yes.
Well, Melanie, first of all, thank you for agreeing to be on the show again, because it's been a couple of years, I think, when you first came to Kingman and first started at KRMC. We had you on the program and we talked about speech language pathology, what that meant.
Yes.
And I think for our viewers who haven't seen that segment, maybe we should do again, explain what speech language pathology is all about.
That's a great idea, and I was hoping you would ask me to do that. So, as we said, and as I try to tell people about what I do, speech-language pathology is more than just speaking and language. It is also swallowing, it's also voice, it's also the thinking and processing and putting our attention towards being able to communicate.
Oh.
So
it's from here to here.
It's from here up.
Okay.
So it's all of those things, and that can encompass a lot of territory as well as a lot of age groups. So we have speech-language pathologists who specialize in pediatrics as well as adult care. We have folks that are in schools as well as in medical settings. And so with Kingman Regional, we're here to talk about more of that adult speech-language pathology services that we provide and what we can do for the community.
Super. So do you see mostly elderly or seniors, or?
You know, it's a variety, but I would say that we're seeing more middle age to elderly.
Okay.
With some younger folks, we see with traumatic brain injury.
Well, I was thinking that because you're our one and only speech-language pathologist, right? So you must see the whole gamut.
I'm the only speech-language pathologist on the outpatient side, but we do have an inpatient therapist as well as on our rehabilitation side, and we do all help each other. But that is the majority of folks that we see, they're in those age ranges.
Okay. So someone is on staff that sees them when they're in the hospital, for instance, if they first had a stroke, things like that?
Yes.
And then they get sent home, and then that's where you pick up the baton, right?
Exactly. Yes. Or they may be in the hospital and they have an acute stroke, and then they go to the rehabilitation center where they practice all of those things that they need to get better at to be able to go home. And then once they're home, then they come to me. So we like to cover that whole continuum and be of service to people throughout their illness or throughout their disease process.
Right, so we don't just forget about them once we send them out the door.
No.
That's a good thing.
Yes.
Now you mentioned from here to here, so there's a lot in between there that can get covered. So like, how do you help people learn to talk again if they've lost their voice, per se?
Okay, so depending on if the person lost their voice because they have had a tracheostomy or they've had paralysis of the vocal folds, Typically, those services are going to be assisted with the otolaryngologist, the ear, nose, and throat doctor, and the pulmonologist to first of all make sure that person can breathe.
Yeah, that helps.
And then we figure out how do they communicate. So can they communicate using their vocal cords, or do we have to find an alternative until those vocal cords can get better?
I didn't know there was an alternative.
There is.
What is the alternative?
Well, the alternative is writing information, or using augmentative speech generating devices.
Is that like the thing you see people hold sometimes here?
No, that's an electrolarynx.
Oh, okay.
And that would be for someone who doesn't have a larynx any longer. So if they've had cancer and they've had their larynx removed, they might use that as their source for a voice.
Okay.
So there's a lot of different aspects of why someone loses their ability to speak. It may not be how they speak. It may be that the voice or something has changed in the larynx or in their airway, so that we have to figure that out, and we work very closely with the physicians to accommodate the patient and to try to get them as normalized as possible. But speaking of the speech,
yes.
When a person has a brain injury or a stroke, their brain can be affected, and so the muscles of speaking can be affected. And so if the muscles are weak, the speech may sound slurred or it may not sound precise. And so that's a different type of therapy that we would provide. You can have voice problems and speech problems.
Okay.
So it's really...
I always think of voice and speech, but you're saying it's actually kind of two different things?
Well, they help each other.
Right, but it's two
you
different muscles, or?
Well, they're just two different systems. One is the larynx, which is the generator of voice.
Okay.
So air flows through our vocal cords, they vibrate, and we have sound.
Okay.
Our muscles of our mouth and our throat form the sounds that we make. So if you don't have voice but you have movement, your communication's impaired. If you have voice but it's not great and you have movement, it's impaired. If you have movement but the movement isn't good, meaning it's weak, then your communication's impaired.
Interesting. Never realized there could be so many different facets.
And it's fascinating because I look at someone and I'm immediately zeroing in on all those things, and that's where that experience and people who have a passion for what they do. I love what I do. I really do. As we talked before, this is such a wonderful field because you see people and you can help them immediately. It may not get them back to where they were, but we try to get as close as possible, or we find alternatives.
That's awesome. So is it, a lot of times when you're talking about muscles, so do you give them exercises to get those muscles working better, strengthen them?
Yes. So depending on what is weak, we will do exercises to strengthen those muscles. And so a lot of my clients will tell you that we work on tongue strengthening. And there's a lot of evidence that the tongue is important, of course, for speaking, but it's also very important for swallowing.
Sure.
So as we get older, once we get past 68, we start losing muscle mass. And because of that, sometimes that, in a combination with an illness, can cause swallowing problems.
Oh. And the tongue is just a big muscle, right?
It is a big muscle. And those of you who like trivia,
Yes.
There's a debate about whether it's the strongest muscle or the second strongest muscle in the body. But by volume, you know, it is a strong muscle.
So what is the debate? Which is the strong?
Well, the quad, the big leg muscle.
Really? So they put it on that level?
Yes.
Who'd have thought?
I know.
Our little tongue.
I know. Isn't that interesting? So
it is.
Those of you at home, now that you can really respect your tongue, it's important.
And what kind of exercises do you do for your tongue? I mean, is it ahs and ums kind of thing? Or?
Well, you know, if we're working on speaking, then we'll work on sounds. If we're working on swallowing, we're going to work on exercises that use swallowing, because they're two different functions.
Yeah.
So, you know, exactly, they may be placement of the tongue, so you know, for sound. If it's swallowing, we might work on resistance exercises, just like our friends in physical therapy. They do resistance exercises to build muscle. And a lot of our science is taken off of what exercise physiologists have done. So we've
it's
learned from
using
them.
Okay. So what do you put a cherry pit on your tongue and have to press it back and forth? I just kind of picture.
You know, that evokes a whole lot of questions about cherry pits. No, but no, what we might do is use a tongue depressor and have the person press against the tongue depressor while we're pushing towards the patient.
So it's that resistance. Okay, interesting.
Exactly.
I hadn't thought about that.
I know, most people don't,
Yeah.
and actually, you know, when I ask people to stick out their tongue, because that's one of the things that I use for an assessment to see, sometimes when a person has a stroke, it'll deviate to one side.
Just like how if you have a stroke, one side might be paralyzed and not the other.
Correct.
I hadn't thought of that
I
either.
know.
Every time I do this show, I learn something.
Well, and that's why we're happy to share, and I, you know, love to come on. And actually, I was excited about this morning because I thought I get to spend time with Jamie and get to talk to the folks in Kingman. Yep.
Okay, so you look at their tongue, and one side might be kind of. Did you say it leans kind of, or I mean,
it may
pulls
push
in?
towards the stronger side or weaker side, and so that may indicate, you know, there may be sensation issues. So if you can't feel something in your mouth, then you might have food or liquid that either goes into your throat before you're ready for it.
Right, you can choke.
Or food or liquid may get stuck in the cheek, and we call that pocketing. And
not realize it. So kind of like when you go to the dentist and you've had a mouthful of Novocaine, you don't know
exactly
what's there because you can't feel it.
Yeah. So normal swallowing, again, we talk about the tongue and how everyone, I don't think we think about it.
No, it's one of those things, I was just thinking about that. We take it for granted, both speaking and swallowing, because it's kind of, once you've learned how to talk, most of us never shut up.
Correct.
And so you're always talking. We just take that for granted until something happens to stop it.
We do. And so swallowing is the same thing. You know, we don't think about it because we've done it since we were babies and no one taught us how to do that.
We just kind of innately know.
And we develop from being bottle or breastfed to the patterns that we have as adults. And so when someone has a stroke or has a brain injury, again, the brain can be damaged in the areas that make swallowing happen can be impaired, and so we have to relearn how to do some of those pieces again. And sometimes it's more of a development where someone will start out looking like a child and then developing into adult patterns, depending on the severity of the damage that's been done from the stroke or brain injury or progressive disease. But when we swallow normally, and I guess, you know, I am more aware of it because I keep teaching it.
Right.
Yeah. I no longer drive and eat or talk on the phone and eat because I realize that it really is this very complicated process and we should be paying attention. Our mothers told us often, you know, don't talk and eat.
Right. And
pay attention to what you're doing, and there's a reason for that. Yeah. So when we eat, we're forming food or liquid in our mouth in a bolus, and saliva is important to help break that food down. And then we trigger our swallow, and simultaneously our nose closes off from our mouth so we don't have stuff coming out our nose. And we get that good pressure, and our tongue is pushing the food back in our mouth, back into our throat. Our larynx elevates, and within the larynx, the true and false vocal cords close to protect our airway, because that's the entrance to the airway. The epiglottis, which is over the larynx, closes also.
Wow.
The muscles of the throat start squeezing, and when the larynx elevates, the sphincter-like opening to the esophagus opens, and then the food or liquid goes into the esophagus. So it all is very quick and efficient, but if muscles are weak, or as we get older, things get a little slower, it can become inefficient, and then that's where we get into trouble. And that's where I come in.
So that is another reason why people shouldn't eat so fast.
Yeah, and chew.
And you have to chew your food well.
Chew your food. And that's why you see a lot of choking in restaurants on what? Pieces of meat. And why?
Because they don't chew it well, or it's tough, and they just...
Or they might have a little weakness, and then this thing has happened, but yeah.
That's crazy.
I think of it very differently now.
I bet you do. I bet you do. So how did you get into speech pathology? I'm going to segue back for a second.
Okay.
actually, you know what we're going to do? We're going to take a quick break, and then we'll come back and talk about education and the other pieces. I know there's some fun stuff coming up soon we want to talk about. So.
Excellent.
Okay,
Thank you.
We'll be right back. Please stay tuned after these messages. Welcome back to Your Health Matters. My guest today is Melanie Bradle, speech-language pathologist here at KRMC. Thanks again for being on the show, Mel.
Thanks, Jamie.
So before the break, we were talking about education, how you become a speech pathologist, and truthfully, I'm curious, how did you ever pick speech pathology?
Well, I'll start at the beginning.
Okay.
I went into the field, thought I wanted to be a business person, which I do like business, but
Yeah.
I love people.
Okay.
I think we all have established that by now. And at the time, my mother was a nurse, and she made some arrangements for me to follow some therapists at the hospital. And so I was intrigued by what I was seeing in the speech area. And about the same time, my father had a stroke. And so when I saw that firsthand and saw a man who was a World War II Navy veteran, unable to speak, and really struggling, and then him working with a speech-language pathologist to get...
So you saw the miracle happen.
I did.
That's awesome.
And what she taught him and how respectful she was of him made all the difference. And I thought, wow, that's something I want to be.
That's cool.
So,
that is cool. I didn't know that.
Yes.
That's
Yeah.
very cool.
Yeah.
So then what education you have to get to be a speech-language pathologist?
Well, a speech-language pathologist at this point in time has a master's degree. So you have a bachelor's, usually in communication sciences, and then you apply for a graduate program. And once you finish that, then you do a clinical fellowship year, which is a 9-month position.
Wow.
It's kind of
Unpaid,
confusing.
right?
No, it's actually a
you
paid
get
position.
Paid. Oh, that's good.
But the expectation is that that's where you're being mentored by people who have...
You're kind of getting more hands-on.
Exactly.
Under the guidance of someone who already knows what they're doing. So that's a good thing.
It is. It's a very good thing. And so that's the entry level, is the master's degree. There are also more of the PhD, which are in the academic setting, so they're more of the teachers and scientists, researchers. And then there is also some growth now with our field in the area of clinical doctorate. So that's more of your experienced, seasoned clinicians who are doing more of an advanced postdoctorate postgraduate program.
Okay.
Yep.
Awesome. Now, I know that we talked before the show, there's some special dates coming up in April and May.
April and May,
Okay.
yeah. So I'm glad you brought that up. So April 16th is World Voice Day.
Okay.
And what that is...
We all have to go around singing on April 16th.
Well, you could, but it's a celebration of the science and the art of voice.
Okay.
And so many countries across the world are all celebrating this day to remind those of us who have a voice of how important voice is, and if we don't have a good voice, what we might be able to do about it. So otolaryngologists are ear,
How
nose,
long
and...
did it take you to learn to say that? Sorry. It just comes off your tongue so easily. You obviously practice that muscle.
I do, yeah. I love those kind of words, multisyllabic words. But so our ear, nose, and throat doctors,
Yes.
or otolaryngologists, work very closely in diagnosing and looking at voice disorders. So we want to make people aware of that, and so April 16th is that day to celebrate that. And
Very
actually, professional singers are folks that use ear, nose, and throat and speech pathology services because
their voice is so important to their
yes, and that it's their instrument. And so they want to make sure that they keep it in as healthy of condition as possible.
Sure.
And it's kind of like an elite athlete who runs marathons all the time. These people who are professional singers, that's what they're doing. There are also those of us who like to sing in the shower or in our choirs, that we want to have as good a voice as possible. And so, again, that's another aspect of voice. So on World Voice Day, some of the things that they want to remind us about is, if we don't hydrate enough, meaning drinking water is really important to the health of our voice. Thinking about if we're overdoing it with our voice, if we're in an environment where there's a lot of noise and we're shouting a lot and we feel that our voice is getting tired, we want to try to change the environment or be a good listener and just listen. Trying to speak in healthy environments, so staying away from smoking. And I think their expression was, if you want to be hot, you can be hot, just don't smoke.
I like that one.
I wrote a couple of the notes down. Making sure you use good breath support, so if you aren't breathing properly, your voice doesn't have the opportunity to be used the way that it's intended to be used. Yep. And if you are a public speaker, voice is important, as you, Jamie. And so one of the things that they want to remind people is hug a microphone. So when you're speaking, whether that's at your church or temple or in your work environment or at school, make sure you're using a microphone so you're not shouting, and that
straining the voice again.
Yep. Yeah. And then one other thought is, don't clear your throat. So a lot of us who have postnasal drip or
allergies this time of year,
it's better to take a sip of water than it is to keep clearing your throat.
Interesting. So does that actually kind of strain your voice then, or your throat?
It's abrasive for the voice. So the vocal cords, when you cough, they have to slam together. And so if you keep doing that, they get red and inflamed and sore.
Makes sense.
And then we can get into bad habits where then we start clearing our throat just
all the
because.
time, just because. That makes sense. Now, there was something in May too.
Oh, thank you, Jamie. Yes. So May is Better Speech and Hearing Month.
The whole month.
The whole month.
Okay.
So that is an opportunity, again, to showcase and remind people about the importance of communication and hearing. And so as we said, communication is more than just speaking, but it's also, the listening, the thinking, the voice, the swallowing, all of those aspects.
Interesting. So we're going to celebrate that the whole month of May then.
Yes.
That's a good thing.
Yes, ma'am.
So I know you mentioned there were some other things, now, like the breathing. I have to admit that as I've gotten older, I don't think my breathing is as good as it used to be, and I catch myself if I have to consciously be aware when I'm talking, especially, to pause long enough to take a breath. And that's something I never did before, but I find myself running out of air.
Yes.
Is that common?
It is, and again, it is sometimes bad habits that we get into, so we start developing inefficient breathing. So if we're talking and we're in a hurry and we're using our shoulders to try to force air in, it's very inefficient. Versus if we're speaking, we want to be in good posture, not slumping on our muscles, and using our diaphragm and our abdomen, those muscles, to open up the rib cage so that the lungs can expand and you get a good deep breath. And by doing that, then we have nice air control and nice voice.
Okay, so that's something to practice. I can do that.
Absolutely. And strengthening those abdominal muscles can be really important to that. But sometimes it's just focusing on our breathing and making sure that we're really using those muscles, and especially under stressful situations, we tend to tense up and we don't expand. And so,
and I hadn't thought of that, but I know, like, personally, I carry my stress in my shoulders.
Me too.
So the more we do that, the less we're breathing well.
Correct.
Just as a cycle,
Yeah.
Interesting.
It is. It all works together.
Just don't appreciate our bodies. Sometimes they are miracles.
They really are. They really
all
are.
come together.
Yeah.
Now, I want to go back because I know we have a few minutes before the end of the show. I thought it was interesting what you said about your dad and watching his recovery, and then you're doing that again. And so that it has to be a very cool thing to be able to have someone that comes to you in distress. They've had this injury or illness that has caused them. And again, one of those things we take for granted until it doesn't work right.
Yes.
And then to be able to help them and see them through that process. I mean, I know every patient's different, but what's kind of the normal length of time for And we'll have to talk fast because our time's almost up. But
well, it really depends on the severity of the injury.
Okay.
And so, you know, the more severe something is, the longer it's going to take. But the thing nowadays in science is we talk about neuroplasticity, that the brain never stops getting better.
so it can keep learning.
It can keep learning.
So that's the important thing as we end here now, to say don't give up. Keep trying.
That's right.
Thank you for joining us today. I hope you'll be here again next week when I'll have another exciting guest on the program.